When there is a fetal demise before 12 weeks, the baby's heartbeat stops after having seen the baby initially grow in the uterus. We call it a missed miscarriage. And one of the ways to deal with the missed miscarriage is to do a surgical evacuation of the products of conception. So the first step entails putting in a dilator to dilate the neck of the womb or the cervix so that we can pass the suction cannula inside the uterus to suck out the contents of the uterus. So we've now taken the number 7 cannula and we are going to connect it to the suction tubing. What we can see on the screen is the gestational sac with the fetus in situ that has unfortunately demised. The suction cannula is now going into the uterus and we start sucking out the contents under ultrasound guidance. Once the suction cannula is inside in the right place, we start twisting the suction cannula to decompress the gestational sac and ensure that it comes into the cannula and we can evacuate the contents of the uterus. So you can see the sac is decompressing slowly. It takes time. So as you can see, we have partially decompressed the sac. Almost getting there. We now have the ovum forceps inside and we're trying to get the contents out. So now we have some more tissue left inside and we're going to do a gentle curettage to clear all the contents inside. Otherwise, we stand the risk of having infection and future adhesions which will hamper with subsequent implantation of the pregnancy. When we do the final check curettage, it is important to clear the products from the upper wall, the lower wall of the uterus and the 2 side walls. The curettage must be a gentle curettage and not an overzealous curettage. An overzealous curettage will lead to adhesions or scar tissue formation inside the uterus, and that will hamper with not only the flow of the period subsequently but with future pregnancies. We are coming to the end of the procedure and the uterus now looks completely clear. So the procedure is now complete and as you can see, the uterine cavity is completely empty and that's the end of the procedure. The procedure has been covered with broad spectrum antibiotics and the patient will be discharged home